Good morning. This is the Blain's World podcast that can be found each week on Facebook, YouTube, and LinkedIn. You can also listen on Spotify or Apple Podcasts, and to get more information and listen to previous shows on our website, www.blainesworld.net. I'm your host, Blaine Greenfield, and I'm here at my Zoom studio in lovely downtown Fairview, North Carolina. Each week, we focus on positive news and information about people and organizations in both Western North Carolina and throughout the country. And toward that end, it's my pleasure to introduce Dr. William Hathaway, CEO at MAHEC here in Western North Carolina. And Bill, you can feel free to wave to all your fans and friends who are watching this. Okay, and so that's Dr. Bill Hathaway, and he is CEO of MAHEC, Mountain Area Education Center, where he and his staff of more than 1,000 individuals. By the way, Bill, that blew me away when I saw 1,000 folks. Wow, are committed to recruit, train, and retain the healthcare worker necessary to promote the well-being of all those living in our region, including our rural and under-resourced communities. Before joining the nonprofit organization a little over a year ago, Dr. Hathaway spent more than 2 decades working to meaningfully improve health across Western North Carolina as a MAHEC board member, and he was also the chief medical officer of the region's largest hospital system and is a practicing cardiologist. Beyond his busy days at work, Bill is a proud family man, first-time grandpa, congratulations, and an unabashed dog lover. He and his wife, Sharon, recently adopted their 6th golden retriever, Breezy, a friendly pup. Bill is hoping to train that pup to become a therapy dog for patients and homesick children away at camp. I have to ask you, Bill, maybe at the end of the show, we'll get to meet one of your pups.
Yeah, we'll see if we can bring Breezy or Bitsy in. Yeah, that'd be great.
Okay, and the question I have to ask when I meet somebody for the first time, as a kid, you grew up where?
I grew up in Wisconsin.
Okay.
Small town, central Wisconsin.
And when you were growing up in Wisconsin, aside from being a Packer fan, did you always know you wanted to be a doctor?
Well, it's an interesting question. We have a long line of healthcare professionals in my family. My grandfather was a physician. Actually, he was in medical school during World War I and volunteered to be a medical corpsman and went over and served in France for 3 years and came back and finished his medical training in 1921, so over 100 years ago. And I have 2 diplomas in my office, his and then my father's, who was also a physician. Interestingly, my father and both of his brothers were physicians. So, and then on my mom's side, my mother's father was a dentist, and now my brother is a dentist. We became that or ministers, and so I chose the science pathway. And I don't know if I always knew it was always there in the background because they had such profound influence in my growing up. But I've known for a long time, and it just seemed like a natural fit given my interest in people and my interest in science.
So it must have been great having your grandfather and father both in the profession. So you knew your grandfather, right? You grew up with your grandfather?
No, I knew him only briefly. He died when I was 5 years old. You mentioned the Packer fan. I remember the date of his death because he died on the day of the first Super Bowl. So that day sort of lives in infamy in our family. And I forgot to mention, in addition to serving in World War I, then he went back and served in the European theater for 5 years as a general surgeon in Europe. And so lots of service that way. Really a remarkable man. He cast a big shadow, even though I didn't know him very well as a kid.
That's an amazing story. Was he or your dad a cardiologist?
No, he was a general practitioner back in the day, did a little bit of everything. My father was a kidney specialist, a nephrologist, and then an internist, and I became an internist and a cardiologist.
So what got you into cardiology?
2 things. Well, more than 2 things, a number of things. First of all, my father as a role model was the biggest influence. You asked about my grandfather. Well, I didn't know him. My father worshiped my grandfather, and I, saw my father as a hero prior to his death. He was sort of the consummate family physician. He was an internist, had an outpatient and inpatient practice, and then specialized in kidney disease. But he had long-standing, deep and meaningful relationships with his patients. And that, to me, sort of epitomized what a physician was all about, the long-standing relationships. But I did my training at Duke, and I got excited by the high intensity care of the sickest of the sick patients. And so for me, cardiology offered the opportunity to have those long-standing relationships. I could see a patient when they came in with a heart attack or an acute heart problem in the hospital, and then become their long-standing doctor for years after that. And I got to experience the sickest of the sick, the high intensity care that comes with cardiology, and then a lot of procedural work. I got to spend time in the cath lab. So it was really a beautifully diverse practice with lots of opportunity to do different things, a lot of variety, and yet have those meaningful long-term relationships with my my patients and their families, and really made it what it was all about to me.
So talk about the transition then from having a practice to then becoming part of MAHEC. And I guess if I can, before we even talk about what that entailed, Bill, because I'm not as familiar with MAHEC as I should be, and I think a lot of our audience isn't as aware of it should be. We hear it, but what is MAHEC?
Yeah, MAHEC is the Mountain Area Health Education Center. It is an AHEC, and AHEC is an entity that began. The AHECs around the country were a federal, state, and private partnership that began in 1972, so over 50 years ago, 51 years ago. And the purpose of the AHECs were to really meet the problem of the mismatch between where patients were and where doctors were. And so in rural areas, it still continues to be a problem. There tends to be an access issue for people to get to physicians. And so the AHECs were designed to create the workforce of physicians in particular. It's expanded since that time to underserved areas, predominantly rural, but also in underserved urban areas.
And so you were in that, you had an individual practice as part of AHEC, was that it, or how'd that work?
So my journey began with cardiology. I ended up doing my residency at Duke, and that's how I got my North Carolina connections, and met my wife, who's an internist, and her family is all in North Carolina. I actually practiced cardiology full-time up until 2013. One of the things that we did in the mid-2000s was a statewide program to redesign how we deliver care for patients with heart attacks. And it's a long story, and I'll try to summarize it briefly. But the gist of it was we designed systems of care that incorporated first responders and emergency medical personnel and ambulance people and county response systems, emergency departments, all designed to get patients who are having a heart attack as quickly as possible into the hospital for treatment, either with clot-busting medications or with catheter-based treatments, heart catheterizations and stents. And that we published in 2005 in the Journal of the American Medical Association. There was a group of us from across the state, my colleagues at Duke and others in all the major cities. And that became the model for how cardiac care is delivered today. Before, you'd show up at the hospital and every program would do something differently. So fast forward in about 2013, they asked me if I wanted to be the chief medical officer of Mission Health System. And I was only 50 years old at the time. And the question for me was, do I want to leave patient care, which was so meaningful and valuable to me, and focus more on systems of care? And it was that experience with impacting people who I will never meet by changing how we deliver care broadly. You know, people I never met who have a heart attack in Murphy are now benefited from the collaborative work that we did with all kinds of people. And I recognized I might have a similar opportunity being a chief medical officer by impacting systems of care and how care is delivered in a broader fashion. That sort of excited me. It's not as rewarding on an immediate gratification basis, but it was an opportunity to impact the community. And so then I took the job as chief medical officer. And then last year in 2022, February, when I took the job at MAHEC, I saw an additional opportunity, given the great work that MAHEC does in our community, to continue that ability to sort of serve the community through my profession, and get the professional fulfillment and the personal fulfillment while making a difference, hopefully making a difference.
Well, so you were the chief medical officer at Mission, was it?
Yes, that's correct.
Okay. And now you're chief medical officer with MAHEC.
I'm the chief executive officer with MAHEC,
Okay.
yeah.
So I imagine for you, though, that was a change, though, because you did lose some of that personal contact, or you have very little personal contact now with folks.
Yeah,
Is that true?
I stopped seeing patients in 2019, and I'm trying to get back into the clinic. I'm trying to reestablish my cardiology practice because it's just so rewarding, and it's what I went into medicine for. And so stay tuned. I may open up a clinic in the next few months. We'll see at MAHEC to serve cardiology patients. But you know, mostly the opportunity to join the great people at MAHEC and do the community-based work and the educational work that MAHEC does.
And by the way, when and if that happens, let me know. We'll get the word out too. But going back to MAHEC then, so it's just, again, like you said, kind of a well-kept secret, because again, I've been in the Asheville area 15 years. I've heard the term MAHEC, but I don't know exactly, is it a building, is it a facility, or what is it?
It's kind of, it's a good story, and I'll share it with you if you don't mind.
Please.
My joke is, what the heck is MAHEC, right? And like I said, we were established in 1974. So the AHEC system began in 72, as I said. And then in 1974, a group of folks here in Asheville got together and decided they wanted to begin a family medicine training program. And so we started with 4 residents in our first class and a handful of faculty members, and have grown dramatically over time. Residency training, for those who don't know, when you train as a physician, you do 4 years of medical school, and then you do an additional residency, and you can pick a specialty. As I said, my dad was an internist and nephrologist. I did internal medicine, then cardiology. There's family medicine, OB. Once you've completed that training, then you can sit for the board specialty exam. And we started with 4 in our class. It's a 3-year training program. So at one point we had 12 total residents. We now have expanded both with the number of family medicine residents. We have 36 family medicine residents, 12 per class. And we've added a total, now we have 14 different residencies and fellowships of people in training. And next year we'll have, next academic year, which starts in July, we'll have over 215 residents under training. So a great story. Added OBGYN in the early 90s, added psychiatry and surgery about 8 or 9 years ago, added internal medicine more recently, and the list goes on. We have 14 total different training programs.
So explain it, if you would, then. If somebody is interested in MAHEC, or you're explaining it, what does that mean? Do they go to a center, a facility, an office, have a doctor? Explain it, if you would.
Yeah, so our main campus is located in Biltmore Village.
Right.
Everybody seems to know where Fridays and the Doubletree is.
Exactly. It's up the hill, right?
Up the hill. And what people don't appreciate is just how big the campus is up there. We started on Weaver Boulevard across from UNC Asheville, and migrated to a couple of different locations, including with a building on the Mission campus, that bridge building that goes across between St. Joe's and Mission, the former St. Joe's campus. And now in 2011, give or take, we started building on this property behind the Doubletree. And we have 4 buildings up there that is part of the buildings we own, 2 of the buildings we own, and 2 of the buildings the state provided for us. And it includes our family medicine, dental, and internal medicine building. We have a women's center, which includes a large simulation center for education. We have our UNC Health Sciences program there, and I'll share a little bit more about that in a bit. And then an education building where we do our continuing medical education. We see the bulk of our patients there. In order to train people to become doctors and advanced practitioners and the like, and therapists, we have to see patients. And so it's a combined mission of education and patient care. And then we have satellite locations. We have a dental practice in Polk County in Columbus. We have a women's program in Franklin, North Carolina, just in the shadow of the old Angel Medical Center before that was moved out to the highway. We have a practice in Cane Creek, a practice in Woodfin, and our Newbridge practice, variety of other settings. Brevard, we have a women's program. I'm sure I'm missing many of the sites, but you can see we have a big footprint across Western North Carolina.
And who are your patients?
Anybody who wants to be our patient. So while we have a special desire to serve the underserved, we believe that healthcare is a human right and that people should have access to care. And we have a particular focus on those who may not have access either for geographic or socioeconomic reasons. We want to care for everybody. Whether you have insurance or don't have insurance, but especially those who are in need of care and can't get it.
And so does somebody just walk in, and how do they become a patient?
Yeah, they can call our scheduling number for new patient appointments. We're like all healthcare facilities. There's often a little bit of a challenge in trying to get a new patient appointment, but we're doing our best to break down those barriers. And if they call the main MAHEC line and ask to be seen, as a new patient in our internal medicine program or in our family medicine program, or if they're a pregnant woman and need to be seen, you name it, psychiatry, dental, we will do our best to accommodate you.
How about emergency care?
So we don't have, it's interesting, we were considering starting up an emergency medicine fellow or residency training program, and that's on the books as something we're planning, but we haven't done that. But our residents in training spend time in the emergency department in Mission and other facilities in the region. We don't only affiliate with Mission for our graduate medical education care. We partner with Party and the VA and Duke LifePoint and all the other healthcare facilities, Erlanger out way west, Cherokee Indian Hospital. We partner with everyone. Our goal is to be the collaborator and the partner with all the people who provide care in the region and with all the people who need care in the region.
What about a big problem that's happening? People in finding a doctor, and somebody can't get in to see a doctor. Should they call you folks at that point in time?
Yeah, yes, absolutely. We are open to new patients. We'll do our best to get people in. Again, remember 1972, the program was initiated to create the workforce, and we've never worked so hard to put ourselves out of business, right? I mean, that's our goal. It's really interesting, Blaine, if you go back and look at our success rate, I saw some statistics last week of 670, 680 physicians that we've graduated from our programs since 1978. 270 have stayed in Western North Carolina, and over 300 have stayed in North Carolina in general. So all of our graduates, we have over a 50% rate of retaining physicians in the community, which is really, a success story like no other. And I don't take credit for that. Remember, everything I'm saying today has nothing to do with Bill Hathaway. I just am fortunate enough to be the spokesperson for all the people who've gone before me and the people who've made MAHEC what it is today.
So if somebody contacts MAHEC, I'm just trying to understand this, so they can hopefully get in to see a doctor or physician fairly quickly.
Yep.
But as I'm understanding, I guess they don't necessarily stay with that physician. That's not your regular general physician for the next 20 years or something.
Well, so it can be. So we have residents in training, and by definition, the residents are there for a limited time period, right? They'll be there for 3 years if they're in medicine, internal medicine, 3 years if they're in family medicine, 4 years for OBGYN, 5 years for surgery, 4 years for psych. So they're by a limited time period, but our faculty stays there long-term. And so some people will get a resident physician, and they'll always be supervised by a faculty supervisor, but some will also see faculty member as their primary care. So it can vary.
And the tough one in this area, and you can address this if you would, is this whole area of now geriatric care. It's just, I guess, here and everywhere, there are enough folks providing geriatric care.
Yeah, geriatric as a specialty for sure. Both family medicine doctors, the difference between family medicine and internal medicine. So family medicine sees people from, as we refer to it, and I don't mean to offend anybody, but from cradle to grave. So they span the spectrum, including children, including pregnant women, including adults. And then internal medicine focuses on adults only 18 and older. But they both do primary care. We call those the two primary care specialties. Both of those specialties, family medicine and internal medicine, are trained to take care of the geriatric age population, that population over 65 years. And then there are some people, both in family medicine and in internal medicine, go on and get specialty care, and they choose to narrow their focus, especially training, they choose to narrow their focus on that age group above 65. Because we have different life needs as we go through our training, and there's special needs for the elderly that come either related to mobility issues or cognition issues or whatever else happens as we age, where a specialist may be of benefit to certain folks.
Does MAHEC have people who specialize in those areas?
We do. We have some, but there's a need throughout the country. The broken reimbursement system in healthcare, and that's a whole nother story, doesn't make it a particularly lucrative specialty, which is sad. But that drives the specialties in part in which our young folks are choosing to train in. We have a relationship with both the Deerfield and the Givens communities, where we run their clinics there. And of course, those are geriatric clinics by nature of the populations who live in those areas.
So that's good to know. So you're in both Deerfield and Givens?
Yes, we are.
Okay, interesting. The Bill, in terms of the stuff you're doing, talk about something I've been reading about or hearing about. Maybe it's a match day. What is that?
Yeah, so when you do your residency, your medical school training, you have to pick a specialty, and typically people decide in their third and fourth years, the beginning of their fourth year, what they want to do. Do I want to be a cardiologist? Do I want to be an emergency doctor, a pathologist, et cetera? And the way the ACGME, the group that regulates our medical education, matches people up with their training programs culminates in something called match day. And so let's say I choose internal medicine. I'll list a bunch of different programs that I want to interview at. I'll apply to those programs. I may or may not be granted interviews, but with a little bit of luck, I'll be granted some interviews. And then I'll rank all the programs in rank order. So this happened to me in 1988. I ranked a series of programs from all over the country. I ranked, my first choice would happen to be in Boston, Massachusetts. My second choice was Duke University. And then I ranked a myriad of programs from Seattle to San Francisco to Texas. It was all over, different programs, because they met the needs that I had. When I interviewed there, then they take all their interviewees and they rank them 1 to 200, however many they interview. And then the match is this magical computer that takes the applicants' preference list and the program's preference list and ranks them, fills them up. So they try to get the highest match of residents. It's a little bit of an interesting day because you're sort of throwing your fate to the wind. My life, as you can tell, was changed dramatically because I didn't get my first choice. I don't regret it for a minute. I had great training at Duke. I met my wife. I mean, she was my resident. I was her intern. Life couldn't have been better for me at that point in life. But it also ended up with me spending the last 25 years here in Western North Carolina. So it's an exciting day. It's a little bit of a stressful day for our programs and our applicants, probably more for the applicants than our programs. But it's the way the process works, for better or worse.
It almost sounds like a football draft, you know.
Yeah, it is kind of. It's a little crazy, like a computer-based football draft.
The many services you offer at MAHEC, I guess tough question to answer, but out of all of them, what's the one you're most proud of?
Yeah, so someone asked me this question before. I think it was the Mountain Express, and I said, "No, I'm not even going to go there." That's like saying, "Which is your favorite kid?" Right?
Or which is your favorite dog?
Yeah, exactly. Which is your favorite dog? So, what I like to say, I mean, what's beautiful about our programs is that they're designed to meet the need of the community, right? We started with family medicine because we needed primary care. We added on OBGYN because we recognized, and we still have significant challenges in maternal fetal health across the United States, but especially in Western North Carolina, that the community needed more access to care and more physicians. So we're creating physicians who can provide that care. We then went to the state 8 or 9 years ago and we recognized that there was a shortage of general surgeons in rural areas and a nationwide shortage of psychiatrists, especially in rural areas. And so we added those residency training programs. And then we added internal medicine this last year, because that allows for, once you train in internal medicine, then you can do specialty care in pulmonary, critical care, endocrine, cardiology, nephrology, et cetera, all those specialty cares. So I think that, not trying to create any enemies within my own walls, I'll respectfully decline to answer that, except to say that each of the programs offers something different and unique, but all of them have in common that they're designed to meet the needs of the community, and they've done that. As an example, we graduated 4 psychiatry residents this last year, and all 4 took a job with Mission Health System. So
Okay.
that's a home run by every stretch.
What do you see the future of MAHEC?
Continue. So let me trace a little bit more of the recent history. So one of the most interesting things is that in 2015 we had 500 employees, and then in 2023 we have just over 1,000. So we've had tremendous growth. We've grown both with respect to our graduate medical education programs, but we've also expanded in something called our UNC Health Sciences campus. I don't think people realize that in addition to training residents, we have 4 schools from UNC that host programs on our campus in collaboration with us. Those include the medical school. So we have 3rd and 4th year students up here, 35 3rd and 4th year students. We have the Gillings School of Public Health, which is the #1 public health program in the country. And we host up to 20 students on that program doing public health, getting master's degrees in public health. We have the Eshelman School of Pharmacy, which is a program we do jointly with UNC Asheville and the Eshelman School in Chapel Hill, which is the #1 pharmacy school in the country. And they do their 2nd, 3rd, and 4th years here. The way the curriculum's designed now, they'll do their 1st year in Chapel Hill, and then we can host up to 30 students up here for the 2nd, 3rd, and 4th years. And then we have, last but not least, our dental program, where we have 4 4th year dental students come up and work for a semester with us. One of the interesting things about the dental program is that unlike medical school, you can actually go out and practice dentistry immediately upon graduation from dental school. You're not required to do a residency. About half of the graduates will do an additional year, sometimes 2, of residency training. Others who want to go into practice can come up to MAHEC and get tremendous volumes of clinical experience. So it's like a boot camp. They really get the on-the-job training that they need so that they're comfortable. It's intimidating when you go out on your own, even though you're well trained. The first time you're out there on your own without someone to back you up. So we want them to be as prepared as possible. So I see growth there. I see growth in terms of our programs that relate to graduate medical education. We will add additional programs in partnership with HCA and others in the region. And then we will continue. We've had tremendous amounts of community service work that we've done, particularly in face of the pandemic. So when the pandemic hit, as I'm sure you're aware, that the US public health system was woefully inadequately prepared to deal with this. And there's systemic underfunding of public health across the state. It's a county-based system. There's lack of coordination of care. Lots of problems were exposed with COVID. And what MAHEC did, and this was prior to my arrival, I was the chief medical officer at Mission at the time, they stepped up like no other organization in the community to do testing, to distribute PPE, to do vaccinations when the vaccines became available. We were the antibody infusion site for Western North Carolina, well, for Buncombe County. So we met that community need like unlike any other organization had the capacity or was able to do, just because of the breadth of the talent that we have under our roof. And so I fully see us doing a lot more of that community service work as it meets both our educational needs and the community's needs. We have a big footprint in the opioid use disorder work. We're a national leader, thanks to Dr. Blake Fagan and his team, Suchin Shukla and others who've just been spectacular in meeting that response. And I see us doing a lot more work in that arena. And I hope that we'll continue to push hard to close the disparities that exist in maternal fetal health care around demographics related to race, ethnicity, and rural living.
If members of the community want to get involved, do you work with volunteers or do you have volunteers?
Yes, we do. We just started a volunteer program. We recognize that that's a huge benefit or opportunity for us. And so if they call our main line, which is 828-257-4400, and ask to be connected with our volunteer department, we'll be able to help you out that way.
And how do you use volunteers?
So we use them, they're new to us. They just started this spring. So it's a brand new program, and we're using them currently in our walls. Sometimes they do clerical work. Sometimes they help with patient navigation. There's a variety of different settings that we're looking at. We're just on the tip of exploring how we can maximally utilize them right now.
And by the way, a strong recommendation, I would imagine, or it'll come from me at least, is that if there are any high school students or in college students want to think about medicine or medical careers, what a great way to see what it's all about by volunteering at a hospital or your facility.
Yeah, that's one way they can do. We'd welcome that. The other thing that we have, as part of the state AHEC system, we're one of 9 AHECs. We're an independent organization, but we belong to the AHEC Association. One of the AHEC's missions is to create these, what we call pathway programs, to get kids interested in healthcare from a very early point. We know a couple things. One, we know that healthcare is better received and there's more compliance from patients when it's delivered by people who look like you and sound like you and come from the same part of the world that you come from, rural areas. So we're working, we have a program called our medical mentoring program. It's been in existence for 15 to 20 years, where we take high school students and they actually get credit, and we have them shadow physicians for a semester, get a lot of exposure to healthcare. And these are kids who don't have the opportunity. They don't come from families where they would be exposed to this necessarily. So we believe very firmly in getting that window of opportunity open up. And then throughout the training, undergraduate, professional education, even residencies, we try to get people connected to rural practices. We have an AHEC Scholars program where they get a stipend to work with practices in the region. We're grateful for the different physicians who've been through our program and are willing to give back by helping train the future generation of healthcare workers. If you don't know what it's like to work in a rural region, and you're only trained in the big city, then that's what you think healthcare is all about. But we want to get that exposure so we can populate the community with our graduates.
As we wrap up, Dr. Hathaway, if I can ask you two things. One, could you repeat that phone number you mentioned before?
Yeah, our main number to our switchboard is area code 828-257-4400.
Okay, and perhaps more importantly, if folks want to get general information about MAHEC, best bet also would be to check a website. And do you have the website handy?
Yeah, it's real easy. It's www.mahec.net. And there's multiple pages and links within there to get you just about everything you need to know.
Okay, I'd like to thank you, Dr. Hathaway, for giving me in half an hour kind of this overview of MAHEC, which very frankly, I'm sure a lot of people will tell you this all the time. They had no idea what you were all about.
Yeah, I fear that, even after this wonderful half hour that we were able to spend with each other, I just touched the tip of the iceberg. It's really a remarkable organization. I'm thrilled to have been asked to be part of it. We've made a difference in the community for 50 years, and we're hopeful that we'll be around for the next 50 or 100 years, continuing to help with wellness, not just healthcare, but wellness care and improving the foundational thing that people need, which is health, so that they can be successful and have a good career and good family.
And I'm just so thrilled you're part of this whole system. The only thing I regret meeting you for half an hour for the first time is that you're not my regular doctor. I'd love to have you as a regular physician. But anyway, this was great, Bill. Thanks an awful lot.
Thank you.
Okay.